Hello, everybody. I'm Dr. Liz Eckelkamp. I'm the Dairy Extension Specialist here at University of Tennessee, and we're going to probably give it a few more minutes, see if anybody else hops on. But while we're waiting for other people to hop on, I'm going to do a little bit of housekeeping. So you will notice that you joined with your microphone muted and your video turned off. Please leave your video off throughout the whole presentation. I'll turn mine off here in a second. Just in case we have anyone trying to join us from a low internet area, having our video off definitely helps with that whole streaming thing. And we'll hold all of our questions to the end, but do feel free to throw anything in the chat if you have any questions throughout. And Lou and I will get to them at the end of the presentation. So our speaker today is Dr. Lou Strickland. And Lou, I can kind of see your nose in the top of your head.
Oh, hi. Yeah, sorry.
There you are.
Yeah.
Dr. Lou Strickland is our extension veterinarian here at UT. Grew up on a dairy farm and has probably forgotten more about cows than I will ever know. And since he's a vet, he can actually talk to us about vaccinations and when that should be done, because I cannot with any authority talk about those particular things. As people keep trickling in, I'll keep adding them to the meeting. If any of you have anyone who is planning on attending this and hasn't joined in yet, never fear. It is being recorded, and we will post the recording later on this afternoon and send out that link to everyone who registered. So if you haven't registered, I mean, obviously you have because you're here, but if you know anyone who wanted to be here and didn't, make sure they register, and we'll get that link shared with them. And towards the end of the meeting, I'll throw up the completion survey. If you need Master Dairy credit, I cannot stress how important doing that completion survey is, because sometimes people log in with something that says iPhone or home or tablet. And as much as I would love to claim clairvoyance, I'm not. So I don't know who home, iPhone, or tablet are. So make sure you fill out that post-completion survey so we can get you Master Dairy for credit for these meetings if you need it. And without further ado, I will turn it over to our talented and wonderful Lou Strickland.
Thank you, Liz. Let me see, can I get this technology working here? Okay, now do you have the PowerPoint there that you can see?
Yep, sure can.
Okay, very
it's
good.
Not even
Cool.
speaker notes.
Cool. What I've got here is just kind of looking more so along your replacement heifers, your calves. But some of this and quite a bit of it actually can be applied to your dairy, to your adult cows too. So I'm going to go through this as far as some diseases that are preventable and that you certainly face on your farm. I know you do, because as Dr. Eckelkamp just said, I grew up on a dairy farm. I was in the business for about 25 years. So I know where you are. I actually got paid a little bit more money than what you're getting paid right now for milk, which is really depressing. I know that, but we'll move on to some of the care that you can do for your heifers and your animals there on the farm. And of course, disease. We're going to go over some of these diseases, and that's any change in structure that interferes with the intended purpose of that animal. And you can kind of see here this cow. Just a minute, let me get my pointer going. I can't talk without a pointer. There we go. This girl right here, you can see she is really soiled on her back end. She is really thin, and I'm pretty sure that this is one of my pictures of a Yoni's cow right here. So let's kind of move on through some of these diseases that I know y'all face on a daily basis. The first ones I'm going to talk about, though, are diseases that do not have any sort of vaccination. There's nothing but prevention and maintenance to try to keep this off your farm. And this is going to be extremely difficult on a dairy farm. I know, been there, done that, and seen a lot of it, because not only did I was in the dairy business 25 years, I've been in large animal practice and actually dairy solo, not solo, but primarily dairy practice for about 3 or 4 years. So I know these diseases and I know what you face. And this is one that can slip up on you and kind of eat your lunch if you're not careful. This is bovine leukosis virus. It is a causes, now the virus itself can be within cattle and not cause any issues. But once it does start to cause issues, that's when we kind of swap over to leukemia and lymphosarcoma. And this is the heart right here on your right. And this is a heart-based tumor. That's a tumor up on the upper side of that heart right there. And that causes issues with blood flow. I know I've heard some veterinarians and some producers say she died of a heart attack. Well, probably not. Probably she had some other issue similar to this going on that interfered with her heart. Heart attacks are extremely rare in large animal, but most likely this is the issue, kind of a heart issue right here. It causes tumors of lymphatic tissues. You can see the knots here on this cow right here. And these are the 5 places that it really loves to show up. As far as a tumor goes, on the heart, like we just showed, spine, you'll have a downer cow. The uterus, you'll have a cow that's infertile, won't breed back. Abomasum, this is really, really interesting to me. This is one where she will go off feed. She'll actually have blood in her feces. And I know you've all seen that cow that has an eye that bulges out like a Volkswagen. That's because she's got a tumor behind that eye that's pushing that eye out. 1/3 of these BLV infections develop persistent lymphocytosis. So 1/3 of these cows that have the BLV virus develop a persistent high white blood cells. It doesn't matter if there's an infection going on or whatever else. She will have high white blood cells all the stinking time. And this is the cow that can easily pass BLV from one animal to the next. And I'll show you how in just a minute how it's passed. Clinical signs are actually kind of low until they start showing up on your farm. And then you'll think, oh, my word, it's eating my lunch up. But you'll see lowered milk production, fertility is reduced. And it actually can remain dormant until that animal's stressed. And during a period of stress right here where this cow is down trying to calve. And actually, I put that picture in right there. Cows are not actually stressed in cold weather. They kind of like that stuff. They start getting stressed at about 75 to 80 degrees. So you could potentially see some of this pop up in warmer weather. As I said, the clinical signs all depend upon where that tumor is located. Downer cow, you can see her where she's been slinging her head back and forth all night long, right after she's had a calf. Like I said, the abomasum, she'll have black feces, she'll go off feed, she'll develop ulcers, infertility in the uterus, and then that protruding eye, where that's actually a tumor that was removed from behind a cow's eye in the lymph nodes back there and pushing that eye out. Here's how it's transmitted. It's rarely a free virus. It's extremely rare for one cow to walk up to the next cow and boom, it passed on to her. BVD can do that. Other viruses can do that, but not this one. It takes a blood transmission, and that's from needles. Needles are equipment, any kind of equipment that can share blood between one animal and the next is how it's passed along. It can be passed in the colostrum to very young calves, as in a couple of days old. Okay, so it can be transferred in the colostrum, but it's still a lower number. This is most likely the most common route of transmission of BLV. And you can see there it takes less than a 5,000th milliliter of blood for it to transfer from one animal to the next through a needle. I get this question too, because I want you to change needles every shot. And they're going, what am I going to do with all these needles? Where here is a website that you can go to. It'll tell you what to do in the state of Tennessee, but I'm going to help you here real quick. Take your detergent barrels that your acid or your line detergent comes in. And those are excellent sharps containers. Once that container is full, just put the plug back in it. Maybe glue it down or wrap duct tape around it or something to where it can't be opened again. You write, do not recycle on the side of that tub or that barrel. and then you can chunk it in the your dumpster or over in the garbage, and that's legal in the state of Tennessee. Like I just talked about, anything that can share blood, so multiple vaccines, injections, equipment, your tattoo guns. Your tattoo guns can really do it. So what I like to do is dip this over in some sort of disinfectant, whether it be chlorhexidine, or you actually could take a little bit of your teat dip and put it in a bucket and add water to it. And man, that's an excellent disinfectant to put your tools over in before you know, from one animal to the next. But change needles. Don't get the idea you can disinfect your needle because you use a disinfectant on your needle and you're running your vaccine or your medication. I have no problem with a multi-dose syringe gun like this one, as long as you're changing needles every shot. And here's that disinfectant that I was talking about. Probably a lot of y'all got chlorhexidine teat dip as well. And all you got to do is 2% chlorhexidine, 1 ounce to 1 gallon of water, 1 minute contact time. That's easy to remember, 111. And that will properly disinfect your equipment. Okay, I got to manage it. I don't have a treatment. I don't have a vaccine. It would be extremely impractical for me to tell you to remove all your positive animals. I had a producer in Pennsylvania. We tested just to see, and 90% of his herd was infected. So I know what he's going to tell me. If I tell him to get rid of all those BLV positive cows, he's going to say, "Doc, don't you come back around here no more." So that'd wipe out your herd. So that's extremely impractical. I could do positive and negative, but that'd be, once again, that's awfully impractical. But you could identify the ones that are infected and potentially, you know, maybe do your procedures on them last. And there are some papers out there that say a palpation sleeve can pass it from one cow to the next. So if you got your vet coming out or whatever, do preg checks or whatever, if you want them to, you can ask them to change sleeves every time, every cow. It doesn't cost that much more money and may prevent some of the spread. But I can produce just as many papers that say it does not spread that way. But I'm just throwing that out there. You can make up your decision on what you want to do, but mostly manage it. Maybe changing sleeves, changing needles every shot, disinfecting that equipment, those kind of things. Fly bites too, fly control. And that's exactly what I just said. So I'm not going to belabor the point there and just sit there and read it to you. That's exactly what I just said on that last slide, that right there. Just the same type thing. Okay, blackleg is another one that certainly can cause issues on the farm. Blackleg lives in the soil. It lives in the cow's intestinal tract, or the calf's intestinal tract. And it's an anaerobic bacterium. That Clostridium shovii is a anaerobic bacterium. So this is one that's around. It's not going away, but I can easily prevent this one through vaccination. Vaccination is really, really effective on preventing blackleg. And always make sure you booster those calves. Golly, guys, I know you're busy. I've been there, done that too, but try to remember to get that booster in there. And actually, I've started recommending just go ahead and give it to the cow too. Give it to her so it'll boost her antibodies in the colostrum, so that whenever you feed that colostrum to the calves, that you're going to be adding protection to them. If you do have one, this is about the only time I will reach for penicillin. I rarely will reach for penicillin anymore, but penicillin is the drug of choice on blackleg. So kind of keep that one in mind, but you got to go heavy doses often and on really heavy doses. I've saved a couple this way with heavy doses of penicillin, but you got to really, really be on top of it. But vaccination is what I prefer. I actually prefer Covexin 8 as a vaccine for blackleg because it has tetanus toxoid in it as well. And it's only a few pennies more. BVD, Once again, here we go. I don't have a treatment for this. I can vaccinate for it and prevent it through good biosecurity, proper vaccination. You can see there, here's the big thing that I worry about right here is abortions, birth defects, and PIs. It can cause pneumonias, especially in the younger animals. So this is one I like to stay ahead of. And this one can be nose to nose. This is an aerosol, so that if you've got one there that's positive somewhere, they can easily pass it to everybody else. I want to point out this one right here. PIs, this is the one that can eat your lunch. If you got a PI there, that's the one that can really keep passing it along to everybody else. And I want to point this fact out too. This is kind of confusing to some people. All right, PI calves are created during pregnancy. So if it's born a PI, it's always a PI. But if it's not born a PI, it never can become a PI. So it has to be created during pregnancy, like I was talking about. I'm not going to go through this whole thing right here. We've just got several different possibilities that can happen with a BVD infection. You can have acute infection or fetal infection. But here's the one that's the big problem, in my opinion, is the persistently infected animal that is constantly passing it along to somebody else. The acute infections can be bad too, as far as fevers and infertility, and that's causing problems with breeding your cows. So that can be an issue there. But here's what I worry about right down here: PIs and abortions. Here's the way that they're created. Now, I can have an adult PI female that gets pregnant. Now you just go back to this and you go, how in the world, with all this going on, does she still manage to get pregnant? But she can. Now this calf that's inside her is constantly exposed to that PI virus, that BVD PI virus. And now it's born a PI. But notice here, it's the least common route. Less than 10%. And it's probably because these cows don't live long enough to actually contribute that much to creating PIs. But it can happen that way. So you can have a PI cow. Here's the most common route, though. Over 90% of the time, this is the way it happens. This mama cow picks up a BVD virus from anywhere. And that can be from where you bought her at a registered sale, that she picked up a BVD virus, or another sale, some other market. It can be where she is exposed to another animal, a PI calf, let's just say, or she is exposed to a BVD virus that you potentially picked up on your clothes where you visited another farm and then came back to your farm. So that's where I often recommend, if you go somewhere else to somebody else's farm, when you get back home, change clothes, take a shower, something like that before you go out to your cows and milk, or go around your calves, or whatever. It's just simple biosecurity. That's simple, and it's easy to do. It doesn't take that long. It's awfully cheap, and it's a good method of biosecurity. But what happens? Mama cow gets exposed to that specific virus in a very specific window of her gestation, in the first half of gestation. Now that calf becomes a PI calf, and now this PI calf constantly sheds virus. Can shed it to the other calves, causes diarrhea, causes pneumonia, those kind of things. And I'm just showing you right here where it can interfere with your pregnant females, if that calf, and I realize that's not going to happen so much on your farm, because you're not going to have your calves, you're going to separate your calves. So I will say on a dairy farm, it's much lower possibility, but this is always a possibility. And but you still go out among these calves very often if you're feeding calves, and then go back to your dairy cows that may be pregnant. And so you could create a PI. And this calf is just like Pigpen there. I know y'all all remember Pigpen. Constantly shedding dirt. Well, this calf is constantly shedding virus. It also can, this PI calf can affect other calves, especially if you use a, let's just say you've got a mob feeder and you've got a group of calves around that mob feeder. Well, that PI calf can affect your other calves around that mob feeder. Or once again, if you, let's just say you've got them in hutches, you just finished feeding a PI calf, and then you go to the next calf with potentially infected hands or something where you can go to that next calf. So that's why testing these calves is extremely important. This is where I'm going to recommend, who I recommend to test. You can test those calves quick as they're born. Do an ear knot, send them off. You can have your results back. If you, most likely you're not going to have a bull on your farm, but if you do have a cleanup bull, check him if you're bringing it in. And then any new herd additions, and I don't care where they come from, test them, because that's why I said a while ago you could have picked it up from a registered sale, and I've seen it happen. It doesn't just have to be from the sale barn. And you can do the ear knot yourself. Just a little notch right down there at the bottom of the ear. Put it in a red top tube, and you can send that off to Cord Labs, and no charge. They don't charge you for this. So this is something that's really, really inexpensive. It's not that difficult to do, and can pick up on an issue and prevent a lot of headaches. And then if you do have some that you show up, here's some possibilities, maybe send them directly to slaughter. Keep them separated from everybody else. It doesn't pose any threat to humans. You've consumed milk, you've consumed meat, hamburger, steak, whatever. You've consumed BVD virus. Not that big a deal. Okay, Johne's disease. This is one that I've got to prevent. I got to manage it. I do not have a vaccine for this. Here's a big problem right here, or a thought process, that it may be linked to Crohn's disease in humans. But I've talked to physicians and asked them their opinion on this, and they don't think so. The physicians that I've talked to they don't think it's an issue. It's caused by Mycobacterium avium, subspecies paratuberculosis, call it MAP for short. And it causes chronic inflammatory bowel disease. You can see right here, very thickened bowel. And this is not able to absorb anything at all. And all that protein just goes out the south end. And that, like I showed you, that cow a while ago was a cow with Johne's disease. Profuse watery diarrhea. You can see here it's tends to be a little bit more of a dairy disease just because of our management that we have. I mean, it's a perfect setup for Johne's disease in just the way we manage our cows and the way we commingle and have them together all the time. It's just a perfect setup for it. Here, and we got different stages of the disease too. We got stage 1. That's going to be a calf that's infected, and you never know it because they're not going to show signs. They don't show signs until they're about 5, 6 years old, 7 years old, something like that. Stage 2 is an inapparent carrier. And now stage 3 and 4, those are clinical disease. Those are the ones that are going to really be showing and having problems. One of the big problems here is that with every adult with stage 4, there's probably about 20 more that are infected on the farm. So it's kind of like the tip of the iceberg right there. That's what the Titanic saw up top, but that's actually what the Titanic hit down there in the bottom. All right. The way it's most often transmitted is through fecal oral. In other words, cow gets nasty with the bacteria that's in the soil, and it gets in the soil. It lives there for years. We don't know how long it lives there. And then the calf nurses and then picks it up and then gets infected. It's infected then quick as they consume that organism. And it gets down inside the villi that are wide open, waiting on the antibodies for mama's colostrum. So that's usually how that happens in a beef herd. But I realize this is completely different in the way that you're operating and managing your dairy. So it can happen through the milk and colostrum too. If she is shedding in high enough numbers, she'll shed it through her milk or the colostrum. So that's really, really important there for you because you're doing a different management system. You're pulling that calf as fast as that calf is born, and you're going to feed that calf colostrum that you stored back. Well, here's what's really important is to test that cow to see if she even has yonis to begin with. And if she does, you better mark that colostrum and feed that to a bull calf, because it's not going to matter with him, because most likely he's going to go to steer anyway, unless you've got some really high genetics. And then I'm not going to feed that colostrum to that bull because I don't want him having it. So if you got bull calves are an excellent place to get rid of that Yonis positive milk, because they're not going to live long enough to show signs anyway. But on your replacement females, that's where you got to be careful. And so marking that cow, marking that colostrum to know that I'm feeding clean colostrum to that calf. All right, and also if she's shedding in high enough numbers, she can shed it directly through the uterus, directly to the calf. But this is more common on a dairy right here. And I think I've got a slide on how to pasteurize. I hope I do anyway. All right, it's reported as a sample positive ratio, SP ratio. Here is where I can use this for a screening or a culling decision right here. So you see right here, 0.25 is considered positive by the manufacturer. Cord Labs, I think, does 0.5 as positive. But what I can do here is I can use this as a culling decision. So let's just say she's got a, I don't know, I'm just going to throw out a number. She's got a 2.5 or a 2.25 SP ratio. Well, I know she's positive already. Well, that might let me know just how likely clinical disease is she's fixing to break. It also lets me know how likely she shed the milk in the colostrum. So now what I can do with that, so okay, let's just say I've got a cow. She shows a 2.25 SP ratio, and she is 3/4. And then boom, all of a sudden she has a DA. Most likely she's got, sorry, sweetheart, trailer mice, and you got to leave my farm. You're not hanging around anymore. So I can use this as a culling decision but if, let's just say her SP ratio is low and everything else is okay, well, I might can manage that cow. I might can take that colostrum and pasteurize that colostrum and feel pretty safe on feeding it to the other calves. And I can keep her around for another lactation or maybe two, depending upon if I'm wanting to, she's some pretty good genetics and maybe I want to try to get a calf out of her and she's got that low SP ratio. So that's something that you can work with your veterinarian on, making a decision on, okay, I need to cull this cow, or yeah, we can probably get another lactation out of her and maybe get a little bit more milk out of her. If she's shedding in really, really high numbers, let's just say her SP ratio was, I'm going to say 4. That might make me go, golly, I got a heifer calf out of her. I'm not sure if I need to keep that heifer calf. So once again, that's a decision that you need to make. Maybe discuss that with your veterinarian on exactly what you ought to do with that calf. Okay, fecal culture is kind of the gold standard. So what I'll do with an SP ratio is make that decision and kind of go, okay, I've used it as a screening. I know she's positive, but if I want to see just how bad this is, or, if she may break or she truly is positive and not just showing me titers, I can do a fecal culture, but it takes a while. It takes about 3 or 4 months. So totally up to you if you want to go with that one. Once again, work with your veterinarian to see if that's something that you want to do on your farm. You may just want to use that SP ratio. And I got to prevent it. I don't have a shot for that. There is a vaccine that you've got to get, Sarah. Good gracious, that's bad. Sorry, Samantha Beatty. I forgot our state veterinarian's name real quick. We've got a Samantha Beatty veterinarian, and we've also got, Sarah Beatty, and then we've got Samantha Beatty. I get them mixed up sometimes. If you're going to use that vaccine, you've got to get Dr. Beatty's permission. And plus the vaccine's not that good because it'll make her, not only does it not prevent that well, it makes her pop positive every time you do a test on her. So I don't necessarily recommend the vaccine at all, really. And then we're going to feed Yonis free colostrum to that calf, pull it. Let me see if I've got that slide here. No, I don't. Sorry. maybe it's on here. So I know I've got that slide in here somewhere on how to pasteurize a colostrum. If I don't, I'll come back to it. IBR, this is a herpes virus. Once it shows up, it's there from now on. Herpes doesn't go away. It's spread through contact and aerosol, like some other viruses. Abortions, pneumonias, I've got no treatment, but I can vaccinate for it. Lepto, here's another one that can be spread through contact. I mean, direct contact like this. And y'all know this right here. You probably had this same thing happen on your farm. Cow aborts a calf, and everybody's got to come check it out. They got to come lick it. Well, dadgum, now everybody's gotten exposed to it. And also this one here is zoonotic, guys. So if that cow does spit one out like this, please do not grab this with bare hands. And I realize most of y'all probably do have leptotiters already. You've been milking cows for no telling how long. I know I got leptotiters. I know I do. And so this is one you need to still be careful, wear gloves, because it is zoonotic, and wash your hands really well if you deal with that. So I can prevent this one. I got a treatment for it. Tetracycline's one, but also you can use Ceftiofur. And that way, if you're using Ceftiofur, if you're using XNL, now you don't have to keep milk out of the tank. I got to keep milk out of the tank with that tetracycline. So I can treat her with Ceftiofur and I'll be okay. But once again, we can do vaccinations. We can do testing of these cows to see who is positive. And also rodent control. Rodents can carry lepto around in their urine. Listeria is one that can show up. This is one that you just have to, some prevention that you got to do on farm. This is an anaerobic bacterium that loves to grow in rotten silage. I've run into this one more than once, and in an awfully bad situation one time where a cow in the herd was shedding listeria, and they were consuming their own milk. I can't say nothing. I did it too. I've done it too, but I highly recommend it. You don't do that. But she was shedding listeria in the milk, and the wife was pregnant and she aborted. Bad deal. So just be careful with this one right here. It is zoonotic, but I can treat this one with either making sure that vegetation is ensiled right. Also, I can treat it. I can treat this with oxytetracycline, and once again, Ceftiofur. I feel like Ceftiofur does a little better job than oxytetracycline, but you can use either one. But just paying attention to your vegetation, your forages, your silage, your baleage, or whatever. Calf scours, this is something else that I can add in during mama's dry period to help put sufficient antibodies through that colostrum that you're going to be feeding. So, making sure it's good quality colostrum, but this is something that can be added. I just threw that one up. I know there's others out there. Scour guards, the one just always comes to mind first. But this could be added in during her dry period to kind of help those calves out a little bit. But we've also got some other stuff that we can give to the calf too. Let's just say, golly bum, I'm just giving too many vaccines in her dry period. I'm kind of scared to give her another one. This is one that I can give to the calf right up front, quick as it's born, to kind of help out, and then good quality colostrum. Clean calving areas, those kind of things can greatly help with calving, calf scours. So let's prevent some of this business. Here we go. I knew I had to slide in here somewhere. Colostrum, 4 quarts, 2 soon after birth, and then 2 additional. Golly, I keep saying I'm going to change this number, and I just hadn't done it yet. That needs to be down around 8 to 10 hours, guys. And this is really a little bit more convenient for you than it would be a beef producer, because you're going to see those calves on a quite regular basis. And I've had some guys say, well, I just go ahead and feed the whole 4 quarts. And I've been okay. If that's working for you, I'm not telling you to change. But we always went with the 2 and 2. I just felt a little better. I felt like the calf had a little better absorption that way. But if doing all 4 at the same time is working for you, If it ain't broke, don't fix it. Preferably BLV and Johne's free, because that's the way these calves get infected with those two diseases. And here it is right here, a study out of Penn State, where you can pasteurize colostrum 140 degrees for 30 minutes, and that will kill the bad guys up here, and it will not damage the IgGs or the IgMs, the antibodies that are so necessary to that calf that it's going to be getting from mama, from that colostrum. Okay, so vaccines, just real quick, I wanted to go over this right quick. Vaccines are to train the immune system. You can have natural exposure for immunity, but you're gonna be bearing the brunt of the disease if you go that route. But if there's vaccines there, a vaccine helps to reduce the clinical signs of that disease. And that's what I want you to get in your brain right now. Vaccines do not make your calves ironclad. They just make them deal with the disease a little better when they get exposed if they've not had it at all. They're divided into injectables or intranasals or orals that you could use. There's a calf guard that you can give orally to that calf quick as it's been born. We got killed and modified live, and I recommend that you discuss the advantages, disadvantages with your veterinarian on what's better for your farm. This is kind of what I was saying right here. It's a key component of protection, but no vaccine's 100%. It's just going to reduce those clinical signs and help to fight off the disease. And then, of course, read the label. Read the label, read the label. I make the vet students raise their right hand to swear that they will always read the label before they draw up a medication. Read the label again before and then give the medication to make sure that you are doing it properly. And this label will tell you exactly what to do. Just some real quick terminology, kind of antigens are the ones that are causing the problem. That is, antigen and pathogen basically are the same thing. An antigen and a pathogen is what's going to be causing the illness in that animal. Antibodies are what they get out of colostrum, IgGs. IgA is actually a local. It acts right away. Then we got passive and active. Passive is where they're getting it from the colostrum. And then active is where immunity is where you've done your vaccinating. There is mucosal. That's the IgA one that I talked about, where that's local. If it's inhaled up through the nasal passages, boom, IgA is produced, and boom, the reaction happens right then and there. It's fast. But systemic is where you give the shot. That's the active immunity, and you get these others antibodies, but that takes time, 72 hours bare minimum. Then in naive animals never had a vaccine before, never been exposed to a pathogen before. We've got some other innate immunities here. The epidermis, skin is it's ours too. And that calf, first line of defense. There can be natural exposures to pathogens, but it takes time to make the antibodies. So that vaccine, they can get naturally exposed, and then the immune system's got to learn the antigen and then makes memory cells, but it takes time to do that. So if I use the vaccine on that calf, it's basically tricking the system to go on, oh, I've been exposed. I'm going to make cells. I'm going to make immune cells. I'm going to make memory cells to help to fight this off. And it's going to react a whole lot quicker. Just real quick, here's just a cartoon of what I was just talking about. You've got antigen binding sites, and notice, and I realize this cartoon, it doesn't look like hands in real life. But the antigen binding site comes in, that antigen binds to a very specific set of binding site, kind of like a John Deere key. A 4020 John Deere key would also start a 4055 John Deere or a sprayer, because that one key would fit all of them. But a John Deere key won't fit an International, as in won't fit an Alice Chalmer. So they've all got their very specific antibody binding sites to which their antigen binding site, which then they can make that antibody to fight it off the next time. And then that's just another cartoon. The same thing showing you there where it's got a very specific binding site. And then here is kind of what I want you to see is what the immune system does. Here's that antigen that comes in. It's got that binding site. Then it starts to make helper cells that goes on out here to make B cells and macrophages and killer cells. And this is what they do right here. These are cells that fight on down the road. See, here's that memory cell that it makes for that very specific virus or bacteria. So this one fights on down the road, but here's the one, the CD4 cells and the CD8 cells. These are cells that fight right up front. I call these dirty, hairy cells. You know, go ahead and make my day, punk. Because what happens here, that antigen comes in, that CD4 cell attaches to it, and then boom, it releases those granules that help fight right away, help fight pretty quick. And then we've got those cytotoxic cells, those CD8s. They do the same thing. They will engulf that bacteria or virus and then attack it right away. So we've got some upfront stuff, and then we've got some down the road stuff. So that's what these vaccines do, is they trick the immune system into boom, doing this now, as opposed to natural exposure, which is going to take me, oh my word, it's going to take me a week to go through a natural exposure. So here's some core vaccines that I've got right here. Just the clostridials, the respiratories, the leptos. Probably you're not going to be using too many of these right here, the pastorellas. That's kind of more for stocker calves, feeder calves, but maybe if you're sending your bull calves that you steer out, you may need to use that. Certain private sales still require brucella. So if you've got calves, you've got some calves that you're going to send on to a sale, you're not going to keep them for yourself. Maybe they're good genetics and you're going to try to bring in revenue from that aspect. You may have to have brucella to go to those certain private sales. And then pink eye scours, like we talked about. I've got different routes of administration, the sub-Q, IM, intranasal, and then changing needles every shot, that kind of deal. I realize this one's tough too, guys. You see the south end of your cows quite a bit. Try to refrain from giving those shots back there in that muscle. Try to go around there and use it in the neck. Going to be, according to BQA guidelines, and quite a bit of dairy animals go into the food supply. So we don't want to be throwing those valuable cuts of meat away. Okay, I do have a slide on killed and modified life. Killed, kind of if you're off by yourself, not adding cows very often, killed will work. Excuse me, let me just say minimal risk of abortion. So it's very, very safe for pregnant cows. But it takes a slower onset. It doesn't act as fast. You got to do boosters. Then you got modified lives. If you're adding cows on a regular basis, or you got somebody close by that doesn't do anything, you might want to consider modified lives. Like I said, talk with your veterinarian on what to do. It does have a greater risk of abortion if she's never had a modified live before. What several guys are doing now, and that's because the research shows this, there's folks a whole lot smarter than me, does the research. And what they're doing is they're using the modified lives on the heifers. Then once they're pregnant, carrying a calf, they'll use a killed product on them because it's really, really safe. And you get good protection from that just out of that research. So something to consider and discuss with your veterinarian. Calves, once again, the clostridials and the respiratories. Breeding animals, that's where you're going to add in the leptos. I wouldn't worry about trick or campy in the dairy herd. I don't know if I've ever found trick in a dairy cow, but it's possible, but very, very unlikely. So adding in the leptos, making sure you're using the IBRs and the BVDs. And kind of here, I'm sure this is what you want to know. When do I do it? So if I'm going to use a oral vaccine, I'm going to do it prior to colostrum. I'm going to either use first defense boluses or that calf guard that you mix up and squirt down their mouth for protection against rotocoronavirus. First defense is going to help you against E. coli, salmonella, those kind of things. So those are some boluses to get down first thing. at birth. And then, of course, we talked about 4 quarts of colostrum. You may think this is a little bit early, but actually you can start priming those calves at about 2 weeks of age, because mama's antibodies are really starting to go away at about 4 weeks. So you can start priming this calf at 2 weeks. Once again, discuss with your veterinarian if this is what you need to be doing. If everything's working fine for you, vaccinating them later at 1 to 2 months or 6 weeks or something like that, whatever you're doing, well, don't change that. If the sun's shining, it's 72 degrees outside, golly, my milk check just went up, everything's doing great, don't change. That's fine. But if the milk check just dropped, I got calves dying left and right, it's raining, it's 50 degrees outside, then you may want to consider a little bit earlier where your vaccines and kind of getting that calf a little more protection. Then we're coming out here at 6 to 8 weeks. We're going to do our boosters. Boosters are extremely important because it's similar, just like going to the gym. Going to the gym annually doesn't do very good, but going twice a day does a lot of good because it builds up muscle, builds up defense. So always get those boosters in. Then kind of looking on down the road here, we can booster again, do our brucellas, and then I'll add in my leptos on down the road a little bit, because I'm not worried about that until I'm kind of thinking about getting her into the breeding chain. There we go. That's my last slide. So any questions there before I take off to my next lecture? I got a lecture at 1.
So do I, Lou. So we're both going to be racing to.
Yeah, we're going to be scrambling down the hall. I got to run across the street.
So I don't see any in the chat right now, but if you have any questions at all for Dr. Lou, please feel free to throw them in the chat, or you can go ahead and unmute and ask them directly. I am going to remind y'all that if you need Master Dairy credit for this, I have put the link to that completion survey in the chat, and just in case you can't see the chat, it'll go out in the follow-up email that I send out later today, but it is the word tiny.utk.edu/WW2021. So that again is tiny.utk.edu/WW2021.
And I'm putting one in the chat box right now because it's one of those, I know how it is. I can remember this all the time. I'm going to the parts store to get parts. Halfway back home, I'll go, Dad, burn it. I just remember there's something else I'm supposed to have. So I'm putting in here, yep, a website where you can, where you can send in questions, and it will send me an email. Hey, Liz Eckelkamp's got a question about her cows, and you can send, it'll email me and tell me, hey, answer this question, pay attention.
Constantly. Liz Eckelkamp constantly has questions about her cows.
Yeah, she does. She's pretty high maintenance.
She really is. Can't stand her. But if y'all have any questions at all, definitely go to askdrlou.tennessee.edu or email me or email him. We're all pretty responsive to things, as long as they don't get lost in the email shuffle.
Oh my, y'all bear with me if I don't answer your email right away, because I get about 200 a day. It's easy to get lost in the shuffle.
And if we don't respond for about a month, send us another one.
No, send it quicker than that.
Well, that too.
Yeah.
You've got a better turnaround time than I do, Lou. So I did have one question for you. I get asked quite a bit, what vaccines should I be giving my calves as soon as they hit the ground? And I know you had your sheet, but would you recommend vaccines, or would you recommend more focusing on mama during the dry period and getting that colostrum within a timely manner?
Yes. Okay, let's do colostrum on mama. Kind of a two-step system there. Let's make sure we're getting those vaccines in mama. Once again, work with your veterinarian to see what works for your farm, your dry period issues that you might be having on your farm. If you're not having scours, don't worry about a scour vaccine. Don't put them in there. But if you are, try to get it in the dry period where mama's got it in her colostrum. And then quick as that calf hits the ground, and I'm picking on scours because that's the one that kind of you can do right away, is like my chart there. do that calf guard where you squirt it down her mouth just right away, or the first defense calf boluses. But that's it. You need to get that good quality colostrum in her. And then on down the road, couple of 3 weeks down the road, then I'm going to start adding in my respiratory vaccines, my blackleg vaccines, those kind of deals.
So you used a word there, good quality colostrum. Can I eyeball it, or what do I need to do to make sure it's good quality?
Okay, couple of different ways that you can go about that. The sure enough easy VW bug model that will get you there is a colostrometer. Measure that colostrum with that colostrometer, mark it as poor, and then give it to the bull calves because, well, sorry, bull calves, you get picked on. You're kind of the redheaded stepchild that gets pushed to the side. And then mark it also, is this Yonis or BLV free? Check that cow, test that cow. Testing is free too. You can do testing that doesn't cost you a dime through Cord Labs. Find out those cows and then mark that colostrum. If you've got a high percentage of the herd that's BLV and Yonis positive, well, then you can pasteurize the colostrum and then mark it. But always measure that quality colostrum with that colostrometer. And if I'm not mistaken, help me out, Liz, there's an electronic one too, right?
There's an electronic one, and there's also a Brix refractometer. Make sure it's the one that says Brix and not the one that does specific gravity. Specific gravity will not get you there. Great for my fish tank, terrible for colostrum.
Important, very important. Yep.
All right. I'm not seeing a lot of movement in the chat, Lou, or anybody unmuting, but thank you so much for your time today. Great talk as always. I always learn a lot. And for those of you listening, please, please, please remember to fill out that post-completion survey. Lou and I would like to keep our jobs. Me more so than Lou, because he's already got tenure, but I definitely want to keep my job. So tell us what you liked. Tell us what you want to learn more about, and we'll get this posted shortly. Thanks,
exactly.
Lou.
We live and die by the evaluation. And
yes, we do.
And if you don't tell us what you want to hear, guess what you're going to hear next time? You're going to hear the same thing.
Whatever we want.
Whatever we want. Okay.
All right, y'all. Well, I'm going to end.
Thank you.
Thanks, Lou.
See you.